I start the Invisalign, and that's going fine until an old problem that I haven't mentioned yet flares up. And now we're going to have to talk about some more anatomy and vocabulary. What's the old problem? It's TMD, which is temporal mandibular disorder. That's a disorder of the TMJ, which is the temporal mandibular joint, a joint everyone has. That's your jaw joint. And when I had airway and sleep apnea problems, I was clenching and grinding my teeth all the time. So my temporal mandibular joint, TMJ, was inflamed all the time, to the point where I had a dull ache in my jaw and like a constant headache. And weirdly, I developed a problem called lacrimal duct emphysema. And emphysema is just a fancy word for air where it's not supposed to be. And that meant my temporal mandibular joint, jaw joint, was so inflamed at one point I could push on it and a bubble would come out of my tear duct. So obviously I didn't want that to return, but when I started the Invisalign, the aggressive schedule the orthodontist had me on, and that's where you wear it for 22 hours a day and you switch every week, caused a flare-up of that old TMJ problem. Why did that flare up? Because before I had the surgery, I was getting Botox in the joint to prevent me from clenching and grinding and giving myself a headache. But I let the Botox wear off because I had the surgery and I was trying to get the ligaments and the joints to remodel around the new airway. So I can't get the Botox again. I can't do the aggressive schedule of the Invisalign, and the only solution is to go to the orthodontist and say, I have to switch the trays every other week, thus doubling the length of any treatment they do. Also, when they do that, the Invisalign doesn't work as well, obviously, because the trays are out for longer, so there's less of a chance they're going to achieve the result in the time that they have set out. So that is why I've been in Invisalign for almost 3 years, because every time I try to up the schedule to be more aggressive, it inflames the joint and I have like a flare up of the TMJ. So that is happening less often now, but no one in my orthodontist's office likes me because I've been their longest patient now. My teeth are getting to where they need to be, but as a consequence, I've had more Invisalign trays than anyone I've ever known.